Hey guys, Dr. Tobisch here again with Whitefish Chiropractic. In the second video of our nerve mobilization series, we're going to be talking about a condition known as cubital tunnel syndrome. Your cubital tunnel is basically a small bony groove right here in the inner elbow. So your ulnar nerve runs down your arm, through this bony groove, down the outer forearm, and it gives innervation to your fourth and fifth finger. If you've ever hit your funny bone before, you know exactly where the cubital tunnel is because you don't have a bone in your elbow called your funny bone. What really happened is you probably pinched or compressed your ulnar nerve right here in the cubital tunnel. So this is an area where your ulnar nerve can experience quite a bit of compression and tension, which are two things that nerves don't love, especially if they're exposed to these forces for extended periods of time. So if your ulnar nerve does start to get irritated here at the cubital tunnel, these people will start to experience symptoms of pain, paresthesia, numbness and tingling down the outer forearm and into the fourth and fifth finger. A couple things that we see that kind of drive this cubital tunnel syndrome, situations like when a patient is spending a ton of time talking on the phone. So it's putting quite a bit of tension on that nerve as it runs around that groove. Other times, sometimes patients will work a desk job and they'll basically rest this area on their desk just distal or right on top of that cubital tunnel, and that will start to compress the ulnar nerve over time. So that's a little bit about cubital tunnel syndrome. Next up, I'm going to show you a simple test that you can do at home to see if cubital tunnel syndrome is what's driving your outer forearm pain. All right, guys, the test that we're going to look at for cubital tunnel syndrome is called the elbow flexion test. So to get set up, you're just basically going to bring your arm up to about 90 degrees. Then you're going to flex the elbow with your palm up. From there, you're just going to keep your fingers long and extend them down. So almost like you're getting in position to talk on the phone, but keeping the palm up instead. You're going to hold this position for 60 seconds. If it starts to produce symptoms of pain, numbness, irritation from the inner elbow, down the outer forearm, and into the fourth and fifth finger, there's a pretty good chance that you're dealing with some ulnar nerve irritation right there in your cubital tunnel. All right, guys, first exercise that we're going to look at for cubital tunnel syndrome is going to be a stretch to get some tension out of these muscles here in the inner forearm. And if you watched our video on carpal tunnel syndrome, this should look familiar because it's the same stretch. So we're going to use those contract, relax cycles again. So basically, you're going to reach your arm out in front of you and point your fingers down. You'll pull down a little bit further with your other hand until you start to feel a gentle stretch here in the inner forearm. Hold that stretch for about 7 seconds. Then we're going to go into that contraction cycle where we're going to lightly activate these muscles as if you're going to pull your hand and your fingers up towards the ceiling, but you're going to block that motion with this hand. You really only need to use 1 or 2% in this forearm, so you don't need to pull hard at all. So again, pull down till you get that gentle stretch, hold for 7 seconds, then we'll lightly activate, hold that for about 5 seconds, relax, and then see how much further you can go. Kind of take the slack out of it. Do 3 to 4 cycles of that 3 times per day. This next exercise is going to be another stretch for a muscle here in the inner forearm known as the pronator teres. So to get set up, you're just going to have your elbow at about 90 degrees, just to your side, lightly pressed into your abdomen. From here, you're going to start to rotate your hand out or try to bring your thumb down. With your other hand, you can add to that a little bit. Then we're just going to extend your arm out in front of you. At this point, you'll probably start to feel a little stretch here in the inner forearm. And again, with this stretch, we're going to use that contract, relax cycle. So from here, you're going to lightly try to turn your hand or your palm the other way against your resistance. So get to that point where you're feeling a light stretch, hold for about 7 seconds. Then we're going to activate or contract as if we're going to rotate our hand the other way. Hold that for 5, relax, take the slack out, and see how much further you can go. Do 3 cycles of that 3 times per day. Next exercise that we're going to look at for cubital tunnel syndrome is going to be another nerve floss, but this one will be for the ulnar nerve. So to get set up, initially, we'll have you kind of make an OK symbol or press your index finger into your thumb. And from here, to pull the nerve down towards your hand, you're going to bring this hand kind of up towards your head, then you'll tip your head towards that hand. Then to pull the nerve the other way, you'll relieve tension at your hand and tip your head to the other side. We'll do 10 of those each time, and we'll do that twice each day.